Hi, I'm Claire Sachs, a patient and patient advocacy blogger. Today I want to talk to you about trust. But before I start, I want to give you an idea of why I'm here. Please forgive me my notes. Sometimes it's hard for even me to remember all of it. These are the diseases: B-strep meningitis, which put me in a wheelchair and gave me chronic strep and chronic back issues, asthma, allergies, diabetes, cataracts from the treatment of the meningitis, peripheral neuropathy, retinopathy. I've had 2 sets of laser surgery, intermittent anemia, gastroparesis, autonomic neuropathy, chronic kidney disease, trigger finger and 8 fingers, tendinitis, a pinched nerve, and there was that breast cancer scare that took 10 days to resolve. And just for context, I'm only 44. Most of these happened, except for the breast cancer scare, by the time I was 40. So you can see why trust is important. In order to survive, I literally have to depend on lots of others. For me, there are 3 specific trust relationships that can affect my care. I'm going to start with trust of self, something you may or may not have considered before now. A lot of us don't even know it's an issue, but my trust in my physical self was damaged first with the meningitis diagnosis. And to this day, I still don't trust my physical self. With every diagnosis, so all of those ones I read off, it's another hit to the trust that I have in my body. If your body is the first to betray you, who are you supposed to trust? The next type of trust is trust in my providers. At this time, I am very picky about the providers I see simply because of all of the things I have to deal with. For my own comfort and effective treatment, I need providers who will treat me as a peer and who acknowledge the importance of the information I can bring about the 3 to 6 months between visits. The last trust area I want to talk about is trust between patients and industry. I'm sure no one watching this will be surprised when I say that there is a somewhat adversarial relationship between patients and industry. It's a love-hate thing. Industry has developed the mechanisms that save our lives, but there is a certain level of distrust there, and it comes down to one basic idea, and that is, given industry's history, we patients simply do not believe that industry has our best interests at heart. And that is very difficult for us, as the healthcare industry is the only paid service that does not bend over backwards to make sure its users are happy and satisfied. It's because we don't have a lot of choice. We basically have to put up or shut up on things like insurance, on where we get our medications, on where we get our devices. These are not things that we can easily shop around for. And with the lack of choice, it's just very difficult to have a say. And let me give you some specific examples. The cost of insulin. I'm sure you've heard a lot about this, but just as a refresher, the inventor of insulin sold the patent originally for $1 because he wanted the world to have a life-saving medication that wouldn't be denied to anyone. When I was first diagnosed in 1991, I could buy a vial for $11. Now, without insurance, it's $350 a vial, and the technology of the medication has not changed in 20 years. So the inflation there is, we don't understand it. We don't know why that has happened. And the last example I will give you, perhaps the most important, is the mental health carve-outs. Because of all of my issues, I have been in fairly consistent treatment since I was 16. I have never been diagnosed with an official mental health condition, but with every diagnosis, you have to change how you view yourself. It changes your identity, and that's a hit to your mental health. So my mental health treatment was necessary for me to attain and maintain stability with all of these conditions. But between non-coverage and non-reimbursement, which by which I mean they said they covered it, but when I submitted the bills, I never got what was promised. I ended up having to pay sometimes 10 to 15% of my pre-tax income on healthcare costs. If you make that after taxes, it's closer to 25% of my income. And we patients just don't have the time or energy to jump down rabbit holes chasing reimbursements that may or may not happen and that we have to start over again in a month. I hope you can understand by the last few minutes how complicated trust is for patients. Between insurance restrictions and industry monopolies, we don't have a lot of choice, and forcing trust in any capacity makes it inherently unstable. I would really like to see improvement in these trust areas. And yes, I know I'm the only one who can fix the first one, but I think it would go a long way towards building a more patient-centered and therefore more efficient system.
Visit buildingtrust.org to learn more.